Welcome back. With life slowly returning to normal, Oregon hospitals want to make sure you're not afraid to get medical attention if you need it.
Yeah, it's been a big concern. Medical experts tell us some people are so afraid of getting COVID-19, they're ignoring serious medical issues and they're not going to the hospital. Well, Cor Harlan is looking into this and he is live with more on that. Cor.
Boy, that is a scary situation. There are a lot of people, as you mentioned, Jenny, who do not have any signs or symptoms of COVID, have other ailments. They are avoiding hospitals and emergency rooms for really no good reason at all. Hospitals are on the move out this week telling people that their facilities, they've taken extraordinary measures to make sure that the facility you go into, be it an ER room like the one behind me here or a general hospital, are as safe as they can make them. People are staying away from hospitals and emergency rooms. That is according to the chief nursing officer at Peace Health Sacred Heart in Springfield. Volumes for hospital and ER visits of all sorts are down during the COVID pandemic. Even some of the most serious ER-related visits are not being made as people experience obvious health warning signs.
Strokes don't go away and heart attacks don't go away. So the hypothesis is that people are avoiding hospitals even when they have emergent symptoms such as chest pain or signs or symptoms of stroke.
It would suggest that many people are putting off or avoiding medical care because of their concern over catching the COVID-19. Hospitals are taking action, though. Temperature checks before admittance, screening for respiratory symptoms are now standard to identify and isolate arriving patients who have COVID symptoms.
So we keep our patients separated from our symptomatic patients that could be COVID positive versus those that are coming without symptoms and seeking other kind of medical care.
And people are also avoiding preventative care, mammograms, cancer screenings, pediatric and adult well visits, and other early detection medical things that prevent small problems from turning into big ones. Rick Dancer is a former candidate for Oregon Secretary of State who survived cancer 10 years ago because it was caught early.
If you're someone who something's not going right, or you have a yearly that you need to do not put it off, because as anybody who's fought cancer before, this is not a return performance that we want to do.
Yeah, we talked to Rick yesterday, and he said at age 50 he got cancer, and the only reason he said that he is alive today is a result of early detection and screening, cancer screening. Jenny and Ken, the hospitals, the medical facilities throughout Oregon and Southwest Washington have gone to great pains over the years to get people to do preventative care, checkups, cancer screenings, lots of other things to detect these little problems that if caught early, and I mean cancer and heart disease and strokes and other things, a lot of these things, if caught early, can be prevented from turning into great big medical issues. And it turns out a lot of people right now anyway are scared to go to the hospital or the ER room, even as they have emergent symptoms, chest pains and other things like that. And they want people to know that that is a no-no. And if you're sick or having some of those symptoms, that you should get to a medical facility just as fast as you can, because they've gone to great lengths to keep the COVID patients isolated from the rest of the community there.